share the slides now.
All good. Sorry. I wanted to make sure.
Okay, we got it. We're recording. So I'm going to start over, and my dogs are about to go crazy there. I can hear somebody on the front porch delivering a package. So hopefully that won't happen. If it does, Coby, you'll have to take over. My name is Nell Hurley, and I'm a member of the steering committee at the Peer Recovery Center of Excellence. We are a SAMHSA-funded initiative that started a couple of years ago. Our mission is to uplift the peer-based recovery support movement and peer support specialists across the nation. So we have four areas of focus at the Peer Recovery Center of Excellence, and the area of focus that I'm assigned to is around building capacity for recovery community organizations. And that core group has been offering learning collaboratives for the last couple of years. Last year, we did one on volunteer management. This year, we are doing our 6-month-long learning collaborative on community and stakeholder engagement. So that's why you are all here to learn about and share your experiences and questions and thoughts about community and stakeholder engagement for recovery community organizations. So this is session 5 out of 6 sessions. If you have not been here before in this learning collaborative, that's okay. You know, you don't, our content does to a certain extent build on the previous sessions, but it's not a requirement that you have attended those past sessions, and they are recorded. You can find them on our website, and I can put a link in the chat if you want to go back and listen to any of the first 4 sessions that we have done on community and stakeholder engagement. So we have partnered with an organization out of Columbus, Ohio called New Reach Community Consulting. And they have been amazing, you know, walking us through this topic and this content. There have been a couple of different presenters. Coby Williams is one of them. He's here with us today. He's going to be leading our presentation. And he's really an expert in this area. So we're thrilled to have him. Just a couple of housekeeping items. You know, we're a small group, and we really want this to be as interactive as possible. We want to hear your questions or your comments, or if, as Coby is talking, it sparks you know, anything like a little creative moment or an insight or an aha or a question, please come off mute. And you can raise your hand. You can just come off mute. You can ask a question in the chat. However you want to communicate with us, whatever you're comfortable with. We welcome your thoughts and your engagement. Today's session is being recorded. It'll be available on our website. And then at the end of our time with Coby, I'm going to talk a little bit about our what we're calling learning extensions. So these are little activities and articles, videos, different things that we are offering to the group that's engaging in this learning collaborative between sessions, so that it's, you know, so that you can get more content and stay engaged with this particular topic. So I'll talk about that at the end. We have 90 minutes together. And I can't think of anything else. So I think I will hand it over to today's presenter, facilitator, Coby Williams. Coby is going to introduce himself and get us going.
Yes, thank you so much, Nell. Good morning, good afternoon, good evening, depending on where you are in the world today. Again, my name is Coby Williams. I'm the owner and founder of New Reach Community Consulting, based in Columbus, Ohio. New Reach provides public affairs services to help organizations connect with communities for important causes. New Reach is specifically focused on social impact. That's something that's near and dear to my heart. And I define that ultimately as something that helps to change, improve, maybe even save lives. And very proud to share that New Reach is a B Corp certified small business. B Corp is the global gold standard for demonstrated environmental as well as social impact. Also definitely want to give a shout out to Creative Thought. Mitzi Moody is the CEO of Creative Thought Consulting. That's the organization that Nell referenced, who has also been a presenter for some of these sessions as well as has designed the extended learning content. And Creative Thought provides continuing education and supervision, administration, program development, community assessment, capacity building, and social justice advocacy to social service professionals. So really good team up for the nature of the work that we do, and specifically to work with you all on this effort. I'm going to share my screen here and share the presentation, but as Nell said, I'm not a lecturer. I encourage, kind of, it's in theme, right? We're talking about engagement, so I definitely encourage engagement from you all as you are able and comfortable doing. Feel free to use the mic and or the chat box. I welcome both forms of interaction with any questions or aha moments that you might have. As I share the presentation, let me know where you'd like me to skip through in terms of the housekeeping items as well now. One moment. Okay. All right, are you all able to see the presentation there?
Yep, I can see it.
This is you. Okay. Good.
Yeah, sorry. I sort of forgot that we had this information on the slides. So I sort of went over all
No worries. It's good that you know it, right?
Yeah.
So we're going to talk about advocating for a change. And, as Nell said, there's been several different topics that have been covered thus far under the broad subject area of community outreach and stakeholder engagement. And, the nature of the work is that it's not sequential. So it's not that you have to have had participated or view the other content prior to this. The nature of the work is oftentimes it works in parallel. But this is, a topic that's near and dear to my heart. And ultimately, for much of the work that I am involved in and have been throughout my career, ultimately, it's either a reaction to or it's encouraging action towards legislative processes, which we'll cover. So during the first session, I introduced what's called the spectrum of social change, and it starts with direct service and it goes all the way up towards legislative activity. So that's what we'll really focus on during our time together, and I'll introduce some concepts of at least what that means to me, and would love to hear what that might look like for you all as well. So, advocating for a change. The first item I'd like to introduce is what's called an issue iceberg. Maybe you've seen this image in this context or another context. And the way I like to think of it is kind of a macro level way of looking at things or activities, if you will. So you think of an iceberg, oftentimes with the first thing that you see, even if you've never seen one in person, we all probably have, familiar with an iceberg itself. And they are events. That's the thing that you see. That is what is happening. It's what's in front of you. It's oftentimes what's visible and or what's physical. And, to overlay it back with kind of the spectrum of social change that I referenced, that arguably is kind of in the direct service space, has a ton of merit. It's worthwhile, but it's arguably you're reacting to something. It's what just happened, and I'm going to react to that. When you go beneath the surface of an iceberg, you see the trends there. Trends are, what trends, what activities, what information are there over time. So that is more of a way to anticipate. So it hasn't hit the surface yet, but you're anticipating something to break the surface based on the information that you have at hand. It's what's been happening, it's what's changing, this is what's on the horizon. So that's a way to be a bit more preventative when it comes to when you're dealing with things or systems. Just beneath the trends, or you could also say patterns, is structure. Structure, or how are the patterns related? So it's kind of connecting the dots. You see patterns and it's kind of, okay, well, what's causing the patterns? It's kind of a pattern itself is almost like a mosaic. So you're kind of piecing that together. So it focuses on what influences these patterns, what are the relationship between the parts, and what are the rules, norms, culture, values, and policies that are influencing the patterns themselves. That's really an opportunity to design. So we talked about events, that's largely reactionary. We talked about patterns or trends, that's largely to anticipate. And we have structures, that's about designing what the structure is or could be. Beneath that are models, and that really focuses on what are the values or beliefs that shape the system itself. So that's going, deep down into the ocean there. That's at the core, well, not the core, but it's at the base of an iceberg. It focuses on what assumptions, what beliefs, values do people hold about the system, and what beliefs keep the system in place. That is really the opportunity where transform comes into the conversation. And the point of this iceberg is really, again, to illustrate the different areas, if you will, that influence a system, and how that make up a system, and different areas of how you might want to influence that system. Does that make sense? Any questions or reactions to that? Now ask Nell and or Cindy to watch the chat too.
If no one else has any questions, I have a question.
Yes.
I'm just trying to understand this, Coby, in terms of peer-based, what kind of the rise of peer-based recovery support, how community and stakeholder engagement is integrated into that, into building capacity of recovery community organizations. So I'm wondering, as you were talking, I was sort of thinking like, okay, so the event could be the emergence of recovery community organizations across the country, right? They're kind of popping up all over across the country. The trend is the need. So a lot of people are losing their lives due to opioids. So the trend might be the opioid epidemic and the continuing, alcohol epidemic. But then I get a little bit lost when it comes to structure and model. So would structure then be the structure of the culture and society that created the opioid epidemic, or would it go back to the structure of figuring out a solution through the creation of RCOs? I guess it just depends on how you want to look at it from sort of a solution standpoint or a problem standpoint. But from I guess from a problem standpoint, the structure then would be all of the,
Yeah.
different things that sort of have driven the invention of opioids and that whole, huge thing. And then the model, I'm sorry, I don't know if I'm even on the right track here, but then the model would be the values and beliefs that shape the system. The model would be
perceptions, beliefs, values, mentalities. And, to your point, structures is kind of where those mentalities live is one way to putting it, and what was built around those mentalities. So I think you hit the nail on the head.
Okay.
And I'm sorry, I see Michelle's hand raised too. I want to invite
I'm
her.
wondering I think that's a really good question, Nell, and I'm wondering if my understanding is right as well, like to kind of think about how our organization has done advocacy and so this is a kind of contentious one, but like events and thinking about in our state, we're having a big push towards expanding the standards related to involuntary commitment. So what does it mean for somebody to be emergency petitioned, for example? And what we are saying as a peer organization is don't expand the standards, because we have peer support organizations that are doing really great work to divert crises. So that's like the awareness for the peer organizations. And then the trends are kind of like looking at maybe how many folks are being hospitalized, but then not being referred to services afterwards, so that there's not like a continuum of care, versus what our peer organizations are doing, which is people coming in frequently and maintaining their recovery on spectrum, so housing, employment, things like that. And then the structure, I guess I saw it, one of the things could be like, what are you up against? So like, what are the belief systems that are in the system that you're in your state? So are there legislators that are really, really supporting recovery oriented systems? And are there legislators that are opposed to it and really like, is the system generally supporting this or opposing it? Are there organizations that are propping one or the other? And also it could be like, what's actually happening in the system currently that's, I don't know, now I'm losing my train of thought too a little bit, but
sounds
like one area. And then the models, I think, would be then go down to people saying things like anhedonia, like maybe the belief that people can't get better, or that they're not aware of they're not aware when they're sick. That's like one belief that could go into it. Another belief that could go into it is that like recovery, that peer support has an impact because there's a trusting relationship, people are coming back. So I'm rambling now, but is that on the right track?
That's so good, Michelle. I'll let Coby say it, but I also want to encourage everyone here to take this slide or this model and see if you can apply, something that's happening in your community to this model, just because it might help you kind of think through it and articulate the issue and problems and solutions. But yeah, Coby, what do you think of Michelle's?
Based on what both you, Neil, and Michelle shared, sounds spot on. Those are great examples. And one thing is that I think even in terms of science, that as you get deeper in the ocean, that's the harder the ice is. So as you go from events to trends to structure to models, that's how more difficult the work is. And I would argue that, my experience, observation, and opinion, most efforts, and we'll touch on that a bit today from just organizations as a whole are really focused on events, which makes sense, right? That's what you see, that's what you can touch, that's what you can feel. However, and we'll touch on it in a bit, there are the work is hard. I won't, I'm a straight shooter, but there are some missed opportunities if the trends, the structure, and the models are not addressed either. And, one quote with this kind of issue iceberg, or just in general, is that culture change precedes policy change. And when when you don't do that, the policy itself is vulnerable. And, you pick the issue. We can, pull up any news site now. There's unfortunately 20 of them, just in the States alone, let alone internationally. Regardless of the issue, you could overlay this iceberg with it, and that statement would hold true even in terms of, laws, policies, or what have you that have passed. Culture forced the policy change. It's rarely been the opposite, but it is incredibly difficult work the further in the ocean that you get there. So, we kind of the framework for these learnings have been, finding the problem. We've touched on that, and what that could look like in terms of engagement. Framing the issue, we haven't touched on so much, but I do love how, I believe it was Nell who referenced that in a previous session I was with you all on, and that's how you can, shift mind sets and rewrite narratives in order to kind of gain support. And that's a whole nother, workshop that can happen as well, as far as positioning and, messaging workshop. I know that's a part of Nell's and Chris's content as well. And this one, again, is focused on policy change, which is ideally you help shape the conversation, shape the narrative. So these are circles of engagement. This is a slide that I borrowed from a colleague of mine. I actually just attended a webinar that she held on a similar topic just yesterday or the day before. And these are the circles of engagement. When you are thinking through planning, designing an advocacy effort, I think this is a best practice on how you really proceed. The innermost circle there, which is number one on the left, is leadership, staff, and board members. I describe that as really kind of getting your house in order, knowing what you want to pursue. I'm a big why, what, and who. That informs the how, which informs the when and the where. And, make sure that you all are on the same page internally. The last time I was with you all, I discussed partnerships, coalitions, and networks. Even before you get to that stage, I would encourage, again, to get your house in order so that you're all speaking and working from the same playbook internally within your organization. The next outer ring, number two there, are supporters and key stakeholder groups. That's when you start to, I would advise where you start to engage with who are the supporters that you might be able to work with and what that might look like. Again, you can check out that recording. If it's a partnership, that could make sense. If it's a coalition, that could make sense, or working within a network could make sense. Then that's where it's advisable that you go for patients, families, and consumers. It might, might be a paradigm shift, or why wouldn't you engage with them earlier? I would argue that those are already hopefully supporters that you have. So what they need are kind of marching orders, so to speak. What they need is to know what is your plan. If you get your house in order internally with number one, and then you team up with folks as appropriate with number two, then you have something to actually, provide to patients, families, and consumers to actually advocate for. So that's when you kind of round up the troops once you do what I call the pre-work. And number four there is that's when you, that's the target, if you will, for whom to engage with externally in terms of the community and the general public, of which can and include policymakers as well. So get your house in order. Then you get your supporters, your network folks together. Then you go with your respective patients, family, consumers, and then you engage with the community and general public at large, which we'll touch on here. In one final plug, I received nothing for this. I think she does incredible work, but specifically Bethany, she's the owner of Snyder Strategies, specifically works kind of in the health space. So this is very applicable. And someone similar to myself who has a background as an activist, as a consultant, and has worked directly with legislative offices. And her site, you can get a lot of free content as well to further detail and explain some of this information. I'll pause there for questions, comments, or reactions. Does any of this look familiar?
Just one comment, Coby. It might look from this slide like people with lived experience are in that third group, patients, families, and consumers, but kind of the nature of recovery community organizations is that people with lived experience make up staff and leadership and boards and governance, and also, the supporters and key stakeholder groups. So people with lived experience are sort of embedded into those first two levels of the circles of engagement. So I just wanted to
Sure.
point that out, that I don't think what you're saying is that, you don't bring people with lived experience into the process until later. Yeah.
Yeah, and thank you for pointing that out. Now, what I'm speaking more specifically to is, I guess, roles and responsibility. So, and even going back to messaging. So even people with lived experience, yes, you're an expert. Everyone's an expert on their lived experience. But going back to messaging, do they have the talking points? Do they know how to talk about the issue in a way that's most beneficial for your organization or cause?
Right.
So I think that's how I look at it in terms of kind of roles and responsibilities, where the inner circles kind of get that fine tuned, and then the folks who are already, my term, already sipping the Kool-Aid, they're already bought into it, but you're actually giving them a way to help you do the work in a way that's most beneficial for your end game. Does that make sense?
It does. And can I give a quick example
Sure.
of this? So from 2010 to 2014, I worked for a recovery community organization in Minnesota called Minnesota Recovery Connection. And in about probably 2012, the Minnesota legislature tried to pass a law that basically said that people with substance use disorders could only get public funding for treatment 3 times. So you have 3 chances to get treatment and get well. And, total discrimination. I mean, we heard about this, and we as a like the internal, the staff of the organization and the board got together and we decided this is something that we want to fight. And we all got on the same page about a strategy and what we were going to do then. So that's kind of that number 1 circle. Then we partnered up with other supporters and key stakeholder groups, like treatment centers, and it was mostly treatment centers, I guess. And then we rallied the recovery community, and we showed up at that hearing at the legislature, and we filled the room with people who work in treatment centers, people who we had one guy testify who'd been through treatment 12 times before he got well. I mean, it was amazing. And it didn't pass. And, we were able to, fill the room with people with lived experience who, needed in many cases, more than three episodes of acute treatment in order to get well. And we made the argument that, if a diabetic, had more than 3 relapses, they would never be turned away by the medical community. And it was a really an incredible experience. So I think that example sort of applies to this model.
Definitely. Definitely. And thank you for that example. And I also want to acknowledge a comment in the chat that I'm paraphrasing here, that I think that people with lived experience can be represented throughout those circles. In personal example, that the comment that you have been involved in the community and coalitions and other organizations for prevention. Yes, definitely. And like I said, there can be represented throughout here. Really, the point of this is more so roles and responsibilities, and who is shaping the game plan, as I put it. I use a lot of sports analogies, and it's who is shaping the game plan, and providing those plays to the folks who you want to run the plays. That's really more so how I look at it. And again, definitely check out. I would encourage you to check out Snyder Strategies content. The webinar I was just on yesterday or the day before, my days are running together, actually was co-hosted with a funder who, pretty timely in terms of what is permissible and generally is not permissible, even regarding advocacy work. And she is a former congressional staffer, so you don't find too many folks who have been on all sides of that table and specifically work in the health space. So moving on here, this is one of my absolute favorite engagement tools. It's to the point where I do this naturally, mentally now, even if it's, kind of behind the scenes from the work. And it's called the Mendelow's Matrix. This is one way that you can do a stakeholder mapping and stakeholder analysis for whom you want to, you can use this for whom you want to engage with in terms of, recruitment or what have you. The context that I'll propose, this is for an advocacy effort. And to back up with definitions, you'll hear me say issue a lot. In my world, an issue is a problem with a solution. So, or an issue campaign. So the context that we'll think of this is a tool that you can use to help move forward your issue advocacy efforts or campaign. And we'll start with the upper right-hand quadrant, which is key player. And the description there, let me back up first. So along the bottom, you'll see a description of interest of stakeholder. You'll see a plus on the left and a minus on the left and a plus on the right. So you'll see interest of stakeholder on the bottom, a minus on the left, a plus on the right, meaning the minus is less and the plus is more. And then vertically, you'll see influence / power of stakeholder. And again, you'll see on the bottom there, the minus, which represents left, and the plus, which represent more. So it's an analysis of how much interest a stakeholder would have, more or less, and how much influence / power a stakeholder would have, either more or less. So we'll start again with the key player quadrant in the upper right-hand corner. And the description is, if that's someone whom a group, maybe an individual, policymaker, decision maker, if they're in that area, they have high interest and also high power or influence. So again, they have high interest and high power or influence. And the description is to manage them closely, involve them in projects and decisions, engage on a regular basis, and work to maintain the relationship. By description, they're a key player because they have a lot of interest and a lot of influence / power. And power, I describe that as the ability to influence other people's lives. That's pretty much my definition for that. If we move to the left of key player, we go to meet their needs. that's someone who has less interest for whatever reason, but they have a lot of power or influence. And the description there is to engage and consult, to increase or maintain their level of interest. And ultimately, your goal ideally is to move them to a key player, so to the meet it right there. And they could be a risk to your idea, your campaign, your issue. So I usually describe the meet their needs as far as, you know, I used to say 90% of engagement is about the invitation. You keep them in the loop, but you might not want to poke the bear. You know, if sometimes you want to, you don't want to upset them. Sometimes you want to placate them. That might be another word for it. I'll go down to the lower right-hand quadrant for keep informed. That's a stakeholder, be it an individual decision maker or a group, who has a lot of interest, but they don't have much power or influence. So a lot of interest, but they have little to no actual influence or power. And for keep informed, it says to make use of the interest through involvement. You consult on their area of interest, and they can be a supporter or ambassador. I believe it's in the first training of this series is where I introduced the ladder of engagement. That's where that can come in. That's where folks who, you know, you want to honor their interests. I'm a fan of honoring their interests and honor of engagement, but you might not want to expect too much from them in terms of actual power or influence because they don't have that to provide. And then last but not least, there's low priority. That's in the lower left-hand quadrant. Those are individuals or groups who have little interest and little influence or power. So they're different from the keep informed because this group has no or little interest and no to little power or influence. And the description there is that you monitor them, you communicate with them generally to keep them updated, and you aim to move them to the right. So you don't ignore them, but you might not expect too much from them. And I know that's a whole lot. I'll pause here for comments or reactions, or maybe how you all might, if anything sounds familiar. The real point of why I like this tool, with finite time, resources, and energy, I'm a fan of prioritizing. Where do you really want to put that time, resources, energy? In my experience, opinion, and observation, I think, unfortunately, too much, arguably, I'll put that in air quotes, of that goes towards low priority. Those are the folks, we're not hearing from them, or maybe they keep informed. We're not hearing from them enough. You know, we want more and more and more. And you might be neglecting the key players, or you might be neglecting the meet their needs section. Again, I'm a big fan of prioritization and utilizing your time, energy, and resources in a way that's strategic. And this is a way where you can, you can literally, I use it as scratch paper sometimes. I'll write out the names of different stakeholder groups when I'm working with clients to see, what makes sense to on whom to engage, as well as how to engage with them as well. So I'll pause there. Any questions, comments, or aha moments that you might have with this particular slide and information? Hearing and seeing none. And some practical examples are, if you want to meet their needs, maybe if it's a policymaker, you provide them a policy briefing sheet. You provide them your policy platform, or if you have a legislative agenda. If it's a key player, you're actively working with them. Maybe they're a member, maybe they're a partnership, maybe they're a member of your coalition, maybe they're within your network. If it's keep informed, oftentimes, not exclusively, I might see, you can argue it, but maybe the media. Those are folks who, they're interested. That's kind of the nature of their role, is to provide information, but they have less power or influence, arguably directly to move your issue forward. They're pretty much a tool to do that. And then a low priority, I honestly don't usually give that a whole lot of attention. You honor the interest to engage, and you want to move them to the right. But I think a lot of the time, energy, and resources, I would argue, should go to the other quadrants as you're developing an issue policy effort. So one of my favorite topics with engagement, advocacy versus lobbying. Work with a lot of clients, and many times the terms are confused, and oftentimes folks don't want to use either one of them. I've shared this in a similar space with you all in the past, that at the least, every community-driven thing, it's certainly nonprofits, they do advocacy. That's why they exist. You're fighting for something, you're fighting against something. Otherwise, you probably would work, spend your time doing something else. So by nature, by definition, in my mind, most community work, most nonprofits, you're already doing advocacy. But let's talk about the differences between advocacy and lobbying. So all lobbying is advocacy, but not all advocacy is lobbying. I'll repeat, all lobbying is advocacy, but not all advocacy is lobbying. So see if I can keep my analogy straight here. It's like saying all bananas are fruit, but not all fruit are bananas. Same thing. You cannot use those terms interchangeably. Doing so is incorrect. So more specifically, what is advocacy? It's public support for or recommendations of a particular cause or policy. Again, to me, especially when you talk about a particular cause, that's why most nonprofits or community serving groups exist. And then you can also have opportunities for policy, which we'll touch on here momentarily. Lobbying is engaging with legislators to influence specific legislation. Unfortunately, I enjoy doing it, but I've had a lot of conversations and teaching and a lot of very high position profile people who run nonprofits, locally, regionally, and nationally, who don't quite understand that definition. The operative words there are engaging with legislators as well as specific legislation. I have witnessed examples of people who did not want to, they're at a networking event and didn't want to sit next to a policymaker because they thought that would be lobbying. Just having a conversation about the cheesecake might be perceived as lobbying. No, you need specific legislation that you're talking about to do so, and it needs to be an actual legislator as well. So you can sit next to the mayor and talk about cheesecake. Mayors aren't legislators. They're part of the executive branch of government. And so that's why I gave an example there of know your branches of government and their role, because there might be, you might be oversensitive to whom and how you engage with people. And even if you are engaging with people who are legislators, so, members of be it state or congressional House or Senate, or members of council or whatever, the structure might be where you are from, those are legislators. And those differ from members of the executive office, who would be, mayors, governors, and of course, president of the United States, and, whatever those terms might be in your neck of the woods. So any questions on these definitions, any aha moments that might come to mind with this?
I have a question, Coby.
Yes.
I should know this, but I'm just like blanking out on it. So if a recovery community organization gets government funding, then they're not allowed to lobby with government funding. They can do advocacy, but not lobbying. Is it true that nonprofit organizations, any 501c3 is also restricted from lobbying, or am I making that up?
That's coming up, I think, on the next slide.
Okay.
Yes. Yes.
just relax.
No, and that's actually a good, I'm glad you pointed that out because also I think unfortunately most organizations think they can't do it at all. That's patently false. Even in terms of lobbying, that's patently false. The source of funding might influence what that looks like. So I use a lot of analogies. So when I was a kid and my grandma gave me $10, and grandma being grandma, I could do anything I wanted to with that money. That's Coby's $10. Now with my mom, she gave me $10. There were rules around that, right? I could, there was a finite. So that's where, by the IRS's definition, they do a lot of things are permissible. It's on their website. There might be restrictions, but things are permissible. However, funders might further restrict that. So to your point, sometimes the funders inform what you can or can't do, and not necessarily the IRS. And that's that's an interesting battle sometimes, but I'm glad you pointed that out. We'll touch on this quickly. I know this might be small, my apologies. This is actually one of the more simplified examples that I came across of that explains the sometimes convoluted legislative process here in the United States. And really high level, so this is on the national level. This probably mirrors in your respective states, and to some degree probably mirrors even on the local level. That depends on if you have a strong mayor, a weak mayor, or if you have a city manager. So those are all factors. But super high level, a bill gets drafted. That bill comes from someplace, and then it works its way through both chambers, the House and the Senate. And so someone comes up with a piece of policy, and it usually starts on one side or the other, be it the House or the Senate. It gets introduced by a legislator. There's a lot of committee hearings that happen. It may make it out of committee. If it makes it out of committee, then the piece of legislation gets voted on. So the similar process happens on both chambers. There's one other piece that happens where so both processes happen in both chambers. That can take years to happen. There's things that were introduced decades ago. Just because something is drafted, just because it's introduced, does not mean it will go anywhere. But let's assume it goes through the whole process. Then there's a process called a conference or conference committee. That's where you have representatives from both chambers, usually bipartisan, depending on the makeup of the respective, who is in office. So it's intended to be representation for both chambers. The way politics play out, it usually is bipartisan as well, who they reconcile that piece of policy. So, okay, what are the trade-offs that we're going to make here? What is this final piece of legislation going to look like? How are, both chambers needs served or both parties need served? And then it goes to the president, in this case, who signs the legislation into law or vetoes it. And then it becomes law. And then it's the regulatory activity is, okay, what does that law look like in practice? This slide alone is, a several hours workshop. There's 2 points I want to make here, and they're related. Each one of these ovals is an opportunity to influence policy. Unfortunately, my experience, observation, and opinion, too much of the advocacy efforts, they come in late in the game. They come in, once a policy has already pretty much moved through at least one chamber, if not both chambers. Each one of these ovals is an opportunity to influence policy. We'll have some examples coming up on the slide next. And specifically, I wish I would see more in the drafting process. That is in every piece of policy that you can name, think of, read about, hear about came from some place. unfortunately, not, in my opinion, experience and observation, not enough of them come from actual advocates. As an advocate, you can draft, design, influence policy instead of just reacting to policy that other people have created. Does that make sense? Questions, comments, ahas, concerns?
I'm just reminded of that when I was a kid, they had that cartoon, I'm Just a Bill. Remember that?
Yeah.
That
Yes.
was good. We should bring
Yes.
that back.
Yes. And it's I've been involved in community organizing, legislative affairs, consulting, been on all sides of the table. How many of the policies, believe it or not, I know particularly on the state level, they're templates. They are templates, like there's Word document templates that you fill in the blank, and you customize it based on your need or your interest. There are opportunities out there for advocates to get more involved in that, be it you tag on to something that's already moving, or even better, you create your own. And one more point, and I'll get off my soapbox. Another sports analogy is, a lot of times advocates play, in my opinion, too much defense. Any sport that I'm aware of, you win the game by scoring more points. You can't win any game based on pure defense. So the offense, to me, is influencing policy at these different opportunities that are presented in front of you.
So can I give a quick example of that, Coby?
Yes, please.
I mean, I think you're right that it like advocacy work can sound really daunting. Like, oh, I don't know how to write a bill, or I don't know how to, this slide is just really intimidating. And or this process, if you're not a politician, or you don't know how that system works. But I'm glad that you mentioned that there are templates out there. There is a guy in Minnesota where I live who he's a person with lived experience. He actually does work in kind of in the field now, but he started out just like many of us as a person in recovery from a substance use disorder, and he got involved, and right now he's in the process of writing a bill that will counter, let me see if I can get this right. In Minnesota, there's a law that in order for recovery community organizations to qualify for Medicaid reimbursement for delivering peer coaching, peer-based recovery support services, in order for that reimbursement, that they have to be members of RCO, the Association of Recovery Community Organizations, through Faces and Voices of Recovery. And he is writing a bill, and I'm not going to say which side, kind of where I fall, but he's writing a bill that basically says that Minnesota should have its own RCO called MARCO, the Minnesota Association of Recovery Community Organizations, because there's a lot of RCOs in Minnesota. So rather than having this sort of outside national group dictate the standards for RCOs in Minnesota, he wants that to be done kind of on home turf. And he wants the legislature to remove the rule or the law that in order to get Medicaid reimbursement, you have to be a member of RCO. So he just took one of those templates and he just wrote it. Like, it had, I saw it. It had, some grammar mistakes, but it doesn't matter.
Yeah.
It's, anyone can write a piece of, anyone can write a bill.
Yes.
And then he went through the process that you're talking about in terms of engaging, other people in order to move it along. So very cool that you don't have to be an elected official to write a bill, right?
No.
Anyone on this call could do it.
Yeah, and to that, that's a beautiful example, and yeah, I love hearing that. Wish there was just way more of it. I mentioned I was on Bethany's webinar the other day, and she mentioned that she's a former congressional staffer, and a few years ago you had really long-term legislators, and that's not the case so much anymore. And the point being is that there aren't as many subject matter experts in those offices anymore. It's certainly not the legislators many times. They might have their niche. They're really solid on certain issues, but they serve on a lot of committees. It's a lot to keep up with. Their staff members oftentimes are the ones who kind of shore up that expertise on the policy side. But those with lived experience, you walk in the door of the expert. There's help and resources to help, frame it up or what have you. But that's the important thing, is your lived experience. The rest is just formatting. I'm oversimplifying, but yeah, absolutely, there's opportunities to engage in that way. So to Nell's point, here are examples of what are permissible by 501c3s in particular. I will give my disclaimer that I am not an attorney nor an accountant. More importantly, I'm not your attorney or accountant, so I can't provide any specific advice to situations. However, I'm well-versed and present and trained and have conducted just about all of these activities. And the source itself, more importantly, is from Boulder Advocacy. They are if not the national expert in this topic that I'm covering today. I've actually got refreshed on this topic from if not the lawyer from Boulder Advocacy a week or so ago. So that's my preface here. And yeah, I saw a hand up. I want to acknowledge that from, let me move my screen here, from Carolina, I believe.
Yes, it's Carolina. Thank you so much.
Carolina.
I had a question. So I'm the founder and the executive director of a RCO in California. And thank you for bringing up Minnesota, because I'm actually trying to use that policy over there to have that out here in California, since we are just incorporating peer support as a evidence-based practice with the Medi-Cal billing out here. I was approached by a city councilman in our area that is running for Congress, and he wants me to join the he wants me to be a part of his political party. And I'm like, I don't even know what to do with that, because as a person, right? Well, for one, I'm looking to see, what he represents, what he stands for, and all of that, obviously. But as having the RCO, right? But being me separate from the RCO, I just don't see how there could be a separateness in that. And so I am kind of worried and concerned that by doing one, I kind of close the door to the other, meaning, the other parties, which I don't want. I advocate recovery. That's who I back up, and that's who we want to work with. And so, I mean, that's pretty accurate, right? There's ramifications with that, even if it's just me, not as the organization.
Yeah, and Carolina, right?
Yeah.
That's a tough one to navigate. I experienced that myself, particularly with your role, and that's not uncommon. There is a separation, right? As a citizen, you can, any of the information I'm presenting, you can advocate or lobby as much as you want. There's no rules, restrictions on that. Within a professional capacity, yes, there's limitations as well as realities, right? And there won't always be perceived as different externally. Unfortunately, I don't have a magic answer to that, other than to navigate carefully. I personally, I get invited to run campaigns. I don't involve myself in politics. I'm issue-based. I focus on policies. And yes, it's kind of my code, issues, people before policy, and I don't even make financial contributions, even in a personal capacity to help with that separation and that code. It's not easy. I ran into a local council member yesterday afternoon, and we didn't talk politics per se, but I'm known and I'm accessible, and I get the invitations to donate and attend and contribute, or sponsor, under New Reach. It's difficult and it's tricky, and I'm not giving you a clear answer other than I think it's savvy to be aware of that. Oftentimes others aren't, even with the best of intentions, they kind of get caught up in that scene. But my best advice would be to navigate that very, very carefully.
Tread lightly.
Yes. Here's a snapshot of what are activities allowed by a 501c3. And I highly encourage you to check out, if you're not familiar with them, Boulder Advocacy. Again, they are if not the national expert in all things nonprofit advocacy information. And there are C3, C4, C6 political action committee versions of this, but I focus on the C3 because it's the one that's a little bit foggier, unfortunately, as I mentioned, due, I think, to a lack of understanding. So the red there is more kind of self-explanatory. The red is things that you cannot do. It's political party, it's partisan, that's a no-go, hard, non-starter. Other forms can do that, such as a political action committee, aka a PAC. You cannot engage, you cannot wave the flags of the DRs or Is as a nonprofit with that column there. With policy development, you can. It's limited. Again, it's a myth that C3 entities cannot do lobbying. You can, according to the IRS. To my point, funders might restrict or limit that, but the IRS says that you can. The general rule, I'm oversimplifying, and check it out. It's on the IRS website. General rule is you can't spend too much time or money doing it. I always joke that the one thing nonprofits don't have is time or money. So, however, I don't think, and I've seen examples of this, that the catering budget should be more than the lobbying budget in a given year. That's a missed opportunity. And the activities include influencing specific legislation. Again, this is what we want done on Bill X. That is specific legislation. That is a policy agenda. If you say that, hey, we want, this is good for RCOs in general, you're not talking about specific legislation. That's called a policy platform. And you are allowed to do either. Policy platform, you can do all day long. That's to say, hey, this type of general type of policies are good for RCOs. That's an example of a policy platform. A legislative agenda, again, is, hey, Bill X is what we want done. And you are allowed to do that with some limitations. And again, back to influencing legislators, where you're allowed to engage with them, break bread with them. You don't have to run to the next table just because the mayor sat next to you with some cheesecake. Any questions on those two columns thus far? Do they look familiar with your understanding or your own work? I'm curious to know if any of your organizations, what is your experience or maybe even stance, if you will, on just lobbying in general?
I'll go. To be totally honest, I have no idea about lobbying. This is all really new. And as the founder and executive director, somehow this keeps everything that I'm learning and the barriers that we face here in California as RCOs in the peer support space, right? Providing a service that I believe supersedes that with the peer support in an agency, and yet not being allowed to have our own space out here in the community and be recognized as like, I keep meeting up with like government officials, like it keeps coming up policy, like things need to change, things need to be enacted, and somehow I end up constantly like at the table. And so I'm like, okay, I'm going to pay attention to this, and I need to know what this looks like, as well as, you know, getting educated in how you do this. In a way, it seems like this is, I guess, kind of what I'm doing. You know, lots like I'm not even really sure, honestly, to be totally honest. So I appreciate the information and just being able to understand. I just know that I'm just speaking where I can and getting a voice and trying to get in front of the congressman, the senator, you know, the city council, like the people that will be able to do some things locally, as well as in the state. You know, we're in a state that has, I don't even know how many counties, 50 something, and in our own county we have 2.4 million. You know, that's almost the size of Arkansas. So I got to be realistic as well of like what can be done here, but then also throughout the state for the voice of the rest of the RCOs also, in making our way here, or we're going to be, it's not going to be good for us, unfortunately. We don't do something now.
Yeah, thank you for those comments. You know, and I think that, you know, so kind of the yellow column throughout the green are unfortunately grossly underutilized if there's not even awareness of it. And what that means is that in my opinion, that's why not just the RCO space, just the nonprofit space as, and in particular at large, is under-resourced. You know, not to be, you know, crass, but there's a saying that closed mouths don't get fed. And that's why certain causes are well-resourced, maybe even efforts that you might be opposed to or fighting against, they are doing stuff in the yellow and throughout the green. And they're proactive with doing that. Whereas I think, unfortunately, a lot of times, again, you know, defense doesn't win games at the end of the day. Yes, Carolina.
One thing I forgot to add is I do belong to a group called the Recovery Advocacy Project, right? This nationwide, and we have a chapter in California, as well as like our state advocacy group with CCAP or ARCC or SACARA, pretty much the same players, right? Just in different spaces. And one thing that I started realizing was like, I'd be signing on to these letters that we wanted to support, right? That would be drafted by other organizations. And I was like, why? Like, it's great, right? We're getting support and adding support, but like, why aren't we writing these letters and sending them straight to us, right? So, and so I started asking those questions. I don't know. I'm just like, why are we, this is good, like great supporting, but like, we need to get up there as an organization and write this as well. And so we started to do that, you know, signing up with the legislative, being on the website and doing that, and having our own account and being able to go in and so kind of slowly learning this, what we see, what we feel strongly about, absolutely, you know, support it and send a letter from our organization. And that was something completely like new. I was just constantly supporting other people in what they were supporting, which again is great. I don't discount that or discredit that at all, because that's where I'm learning from as well.
Yeah, I love that. I love that. You know, I covered it in a previous session somewhat in terms of, you know, partnerships, coalitions, and networks. You know, it doesn't have to be a forced marriage, right? You can team up on something as that makes sense, and you can also do things on your own. It's all for the greater good at the end of the day, but, you know, you also want to make sure that your needs are met, that your organization's needs are met as well. So that's how I look at it. Again, it's like an NBA All-Star game. They come together, they play together, and at the end of the game, they go back home to their home teams. They're all still playing the game of basketball. So it all has merit and value. I wanted to go through these, the green columns quickly here. So they're examples of things that you can absolutely do all day long. There's no restrictions, limitations, anything whatsoever as a 501c3. And the categories are issue advocacy, public awareness, capacity building, and policy accountability. Starting with issue advocacy, organizing, we covered some pieces of that in a previous content with the previous session. Educating legislators. So, educating them about what is your, issue. Again, issue, problem with the solution. Educating them about the lived experience. There's a lot of value in that. Legislative visits. Letters are great, beautiful, fine. Keep doing that. Something that they don't see and should get enough of, or interacting with the constituents with those lived experience as well. Hearing those stories in person. They usually prioritize people who live within their district. And so the more folks that you can round up for those legislative visits has a lot of power with that as well. Public awareness, that deals with public education, various ways to do that, fact sheets, webinars, kind of general messaging activities, educational conferences as well. So conferences, summits, that's where you're generating public awareness at large, and research. Again, I think usually it's fairly niche. There's some organizations that specialize in research. However, you can also do your own research. You almost will never hear that from a consultant. Oftentimes I'm contracted to do aspects of research or needs assessments or what have you. You can do your own as well and provide that as information for influencing policy. Capacity building, our time together is a fantastic example of that. That is an example of doing that activity. Others are nonpartisan voter education. It's disappointing how many, again, organizations whom I've interacted with, huge organizations who don't think that they are allowed to do that. That's the most vanilla thing that you can do. And it's also the most impactful thing, I would argue, that you can do. But you are able to do nonpartisan voter education to hopefully ultimately influence in appropriate ways folks to be champions and supporters of your cause. Or at least to be receptive to that. Lobbying exceptions. Exceptions are, it's kind of a technical term, but it generally means you might be able to challenge your position if it's called out as being too partisan or what have you. It's a lot of legalese. I don't have the subject matter expertise in that specific quadrant to go at length on that, but there are exceptions to you being able to do more overt lobbying, meaning less limitations if it's in response to something that's your organization might be specifically called out on. Training, again, our time together as an example of that. And then the final column is policy accountability. That's influencing companies. There's been a lot of examples of that, really historically, but particularly within the last 2 years. Shaming campaigns, that ain't lobbying. Who you will or won't support depending on what they say, what they don't say in their positions. That's not lobbying. That actually specific an engagement of sorts with the private sector. You can absolutely do that. Regulatory efforts in terms of, okay, if a law or policy is passed or being passed, you help shape, well, how does that influence our space? How does that influence RCOs? Does this make sense? Does it not make sense? Laws and rules passing are one thing, implementation or another. So implementation speaks to the regulatory efforts of how does that look like in practice? How do those things affect people with those lived experiences? And finally, litigation. You can sue. It's expensive, and again, it might be kind of niche, but maybe you work with a partner or organization or in a coalition or in a network with that's what they specifically do. I was a former statewide board member for the ACLU of Ohio. That's what the ACLU does. Lives in the courtroom. That's what of value that throughout Ohio, throughout the country, that it brings to the table. The legal beagles. So that's another opportunity or activities that are perfectly permissible to do in your toolbox. Any question or comments, or maybe other examples of some of these activities that you all do in your neck of the woods? And yeah, Nell's comment. Yeah, there's a lot that you can do. I wish I saw way more of this that gets done. I usually see more, thought and energy going towards Kent lobby, which again, you can by the IRS, check if you can with your funders and what that looks like. But even taking the lobbying out of the conversation, going down to the examples in the green, and those are just high level descriptions. Just imagine what the nature of that work could look like to help move your issue forward and influence the good policy. All of this, really what I would encourage people to consider within your organization is, what is your goal? Is your goal to prevent harmful legislation? And again, that certainly has merit. I think that's playing defense a lot of times, but sometimes that's necessary. And even if you do that, to bring solutions. I have a good friend and colleague of mine, one of the best organizers as well as legislative people who I know. It's rare to know people who have experienced both sides of the table and are good at it. And she says, one tip is, when you engage with decision makers, is to bring solutions. Again, that goes back to the definition of an issue. An issue is a problem with a solution. It's one thing to say, oh, this or that sucks, or it's terrible, or we hate that, we don't want that. And there might be merit to that. They hear that all day, every day. If you bring a solution, that alone a lot of times will perk up ears, because they don't get that. It gives them something to work with. They may or may not agree with you, but at least that can help build relationships and open doors. Another goal is to pass helpful legislation. So again, ideally, that's something that you help to draft, that you help to influence. But it also can be something that's already in the works. We heard Carolina give an example of sign-on letters. There could be examples of to help pass or prevent with those, but let's say it's to help pass legislation. You're bringing supporters, you're beating the drums, you're helping to generate attention or awareness for something, to pass something that will serve your needs. And then to help shape the debate. We touched on that with the iceberg example. And a lot of that might come with messaging. So it's to shift mindsets and to rewrite narratives. That can go with language. Is the right language being used to describe this issue, or the people with lived experiences being spoken about, or the stories being told, being heard at all, and is it being done in a way that really helps the issue? Shaping the debate is a very important, sometimes underutilized. Basically, you don't have to stand on the sidelines. That's another way of putting it. The way I look at it, you're already in the ring. Throw some punches, score some points, and these are examples of ways to do that. And one final slide, and I'll leave it open for any additional conversation, is, at the end of the day, policy begins with people. People are the reason that policies exist. And I think that it's important, particularly with community outreach and stakeholder engagement, that they always stay front and center. That's something that I think, with the work that you all do, maybe on the front lines, to really make sure that decision makers keep that front in mind. Particularly when things start to move down the policy chain, it can just become, just pure messages, and the stories and the faces and the people are lost in it. and it becomes pure process. Oh, this committee, this hearing, this testimony, keeping people front and center, I think, is one of the most valuable things and important things to do when you conduct this work. With that, any questions, comments, reactions, or maybe one thing that you learned today?
Well, I learned a lot. Everything that you've talked about, Coby, is such a great reminder that this is, I don't even know how to say it, like this is our privilege as, you know, people in recovery, who work in recovery community organizations to make a difference. And I know what a grind it is working for a recovery community organization and you know, just doing the work day after day. I've done it for a lot of years, and I just want to thank you for this presentation, because it reminds me of the hope, you know, that, and just, you know, the fact that we do have, our stories have power and our experience is valuable, and we can make a difference. It can be, as I mentioned before, it can be really intimidating and sort of daunting, but and I also want to say, Carolina may have dropped off, but she was saying, like, I don't really know what I'm doing, if I'm lobbying or what. And that's okay. You know, that's part of the process. When I first started working in a recovery community organization here in Minnesota, I didn't know what the heck I was doing. And I just reached out to people constantly, at Faces and Voices of Recovery, at CCAR, at, you know, other recovery community organizations, and people just, you know, brought me along. And so we are here for you at the Peer Recovery Center of Excellence. Coby, I know, is here for you. We're going to be sending out some, as I mentioned before, some extensions, learning opportunities. Those will be sent out via email, so look for those. Go back and listen to the previous sessions if you have time. And I hope you will join us for our 6th and final session in this learning collaborative around community and stakeholder engagement. There's a couple things in the chat. Debbie said she took a picture of the Mendelow's matrix to take to her boss. Yes, that is a really great tool and framework for thinking about things. It also is I've used it for thinking about fundraising, which I know it's a whole different topic, but it's really on everyone who works, well, most people who work in a recovery community organization, that is on their mind. And it's a good framework for that. And then Kristen says, I think not knowing leaves more room to grow and flourish and be able to be a role model for others.
Yeah, absolutely.
Cindy just put a link in the chat for the Learning Collaborative landing page with recording and extension learning. So the link is there.
Yeah, and the last one, registration is still open, and that's on August 11th. All available on the landing page for registration.
Well, thank you so much for your attention and participation, and more importantly, for all that you do. It all matters, and it's, you know, tough work, and hopefully, you know, it's been of value that you've, you know, been provided to additional opportunities to help make a difference.
Thank you,
Coby. You're amazing.
This
was really awesome. Thank you so much. And thanks everyone for being with us.
Take care.
everyone.
Thank you.
See you in August.
Thank you
Thank
so
you.
much.
Bye.
Bye.